In pertussis, what stage follows the incubation, also known as the catarrhal stage? A. The whooping stage. B. The paroxysmal stage. C. The acute stage. D. The convalescent stage. The answer is B. The paroxysmal stage. After the catarrhal stage, an individual with pertussis will progress into the paroxysmal stage. It's during this stage that they will experience uncontrollable fits of 5-15 forceful coughs, followed by a whoop or gasp as they struggle to inhale. The force of these coughs can be such that they can result in vomiting, epistaxis, subconjunctival hemorrhage, or even broken ribs. How long is the incubation period for pertussis? A. 4 to 6 weeks. B. 1 to 3 weeks. C. 2 to 3 months. D. 2 to 7 days. The answer is B. 1 to 3 weeks. The incubation period for pertussis, also known as the catarrhal stage, can last as little as 4 days or as long as 42 days, but a typical period is 1 to 3 weeks. During this stage the disease looks like a regular upper respiratory infection, with sneezing, mild cough, and runny nose. The infected individual is highly infectious at this time, with bacteria spread by airborne droplets after sneezing or cough. You are the nurse taking care of a 40-year-old African American female who complains of fatigue and shortness of breath. Her physical exam is remarkable for erythema nodosum on the bilateral lower extremities. A chest X-ray is performed that demonstrates bilateral hilar infiltrates. She lives and works in a suburb, has not traveled outside of the United States recently, and does not work in a healthcare setting. Which of the following is the most likely diagnosis? A. Meningitis. B. Sarcoidosis. C. Lung cancer. D. Pharyngitis. E. Tuberculosis. The answer is B. Sarcoidosis. This inflammatory condition is frequently found in African American women in their 40s who present with fatigue and shortness of breath among other symptoms, who also have erythema nodosum on the lower extremities, and have bilateral hilar infiltrates on chest X-ray. This constellation of findings is highly suggestive of sarcoidosis. Sarcoidosis results in the formation of numerous non-necrotizing granulomas, most commonly found in the lungs, that can play a role in the symptoms experienced by these patients. Other findings suggestive of sarcoidosis include elevated serum calcium levels with normal serum PTH levels. Tuberculosis can present in a similar manner to sarcoidosis, however, given the patient's suburban living environment, lack of a travel history, and lack of healthcare exposure, the likelihood of being exposed to tuberculosis is very low, making sarcoidosis a more likely etiology. While lung cancer can present a shortness of breath with hilar infiltration in chest X-ray, in a relatively young otherwise healthy patient who also has erythema nodosum and in whom the hilar infiltrates are bilateral, sarcoidosis would be a more likely etiology. The patient does not have any findings consistent with meningitis. Legratian meningitis is petechial, not erythema nodosum, or pharyngitis. What is the hygiene hypothesis in asthma? A. Keeping children's hands clean will reduce asthma rates. B. Dirty water is responsible for many cases of asthma in the developing world. C. Frequent bathing can reduce the severity of asthma attacks. D. Exposing children to pathogens at a young age will decrease their risk for asthma. The answer is D. Exposing children to pathogens at a young age will decrease their risk for asthma. Incidence of asthma is lower in populations exposed to an abundance of microbes from a young age. The hygiene hypothesis suggests that early immune stimulation by multiple forms of infectious agents may push a Th1 phenotype, reducing the Th2, allergic, response. All of the following are common triggers for asthma except A. Exercise. B. Squatting. C. Cold air. D. Emotional stress or excitement. The answer is B. Squatting. The most commonly reported triggers for asthma attacks are cold air, emotional stress or excitement, infection, irritants such as pollen or dust mites, and exercise. Other triggers may include lying down, exposure to cigarette smoke, or acid reflux.